Chronic pain is pain that lasts more than 6 months. Here at SIU, your healthcare team and physician may ask you questions to help better understand your pain. In this video, we will discuss treatment of chronic pain that does not involve medicine but can help improve your day-to-day function. In this video, you should learn the importance of managing pain without medicine. These therapies can be used alone or in combination with medicine to better control your pain and increase your quality of life. Some of the different ways to relieve pain without using medicine, and where you can find more information on these therapies. Some of the important things to think about with pain management include understanding how effective the treatment is, how much the treatment costs, and what to expect when using these therapies. Let's discuss the importance of managing pain without medicine.
Chronic pain is a common problem that affects many people. There are many ways to treat chronic pain, and fortunately we have good ways to limit the discomfort that people feel and to improve their daily function in their regular lives. We commonly use medicines alone for chronic pain, but unfortunately there are many complications and side effects to the chronic use of these medicines, so we try to limit or even eliminate the use of these medicines. Fortunately, we have many other ways to treat chronic pain, and by using them with medicines or by themselves, we can get people more comfortable and can limit or eliminate the use of these medicines. Among these other treatments are warm compresses or warm baths, exercise or stretching, physical therapy, hydrotherapy, which is also sometimes called aquatherapy, TENS, also called transcutaneous electrical nerve stimulation, and complementary and alternative medicine therapies such as chiropractic care, acupuncture, and massage. Psychological therapies including behavioral counseling, meditation, and relaxation techniques can also be helpful in managing chronic pain and well-being. Talk to your doctor about these other therapies to see what's most appropriate for you. It's also important to check with your insurance companies because many insurance companies will cover different kinds of these therapies, and you should find out what's easily available for you.
Now we will hear from a few patients and discuss typical ways of relieving pain without medicine. Let's see what therapies these patients have tried.
Physical therapy and warm and cold compresses have worked for me in the past and are easy to use. I find warm compresses work better for sore, achy muscles, and cold compresses work better for swollen joints. If I'm ever unsure about which to use, I just ask my doctor and he tells me. Stretching is also easy to do at home, so long as your doctor or healthcare team teach you how to stretch safely.
I use hydrotherapy and aquatherapy along with meditation and relaxation techniques to help with my arthritis pain. The hydrotherapy I do in the water, which helps lift my weight off of my joints so I can move them more easily, and I find it to be very effective. The meditation and relaxation techniques help keep me calm and also help relieve the burden of having pain constantly.
So I've had this back pain for a while now, and what I found works pretty good for me is called transcutaneous electrical nerve stimulation, or TENS for short. It sounds really complicated, but it's the easiest thing. I just take these pads, I stick them on my back, leave them there all day long, and whenever I need it, I just click the device on for about half hour at a time, and it takes care of my pain.
So, what therapies give the most benefit for the lowest cost?
I find that compresses, either warm or cold, depending on what's recommended by my doctor, seem to be easiest and cheapest. Other things that I find that work well are massaging the area, staying relaxed, and staying active with hobbies like golfing and fishing, or light exercising like walking. All these things are easy for me to do and low cost.
Now let's talk to a doctor about what to expect when using these therapies.
Side effects are usually mild with these therapies. People with very sensitive skin may have some skin irritation when they use cold or warm compresses or the TENS unit. Sometimes people who do stretching exercises or physical therapy may have a little bit of minor muscle irritation or pain immediately around the time they do the treatments, but this is rarely long-lasting. It's best to use these therapies consistently, and you'll find that side effects go away and the benefits will improve.
So, what have we learned today?
treatments for chronic pain that don't involve medicines aren't used enough in this country. In fact, the Institute of Medicine, in a report that they issued in 2011, found that patients were commonly fearful of doing exercises or things that involve stretching of their muscles or physical therapy because they thought they would have complications, it would make their discomfort worse, or even that they would become paralyzed. None of this is true. These treatments are very safe, and in fact, for people with chronic low back pain, it's well known now that remaining active and continuing to use physical therapy actively will help people function better and will reduce their discomfort. The Institute of Medicine's report also explains that therapies such as physical therapy, exercise, warm compresses, TENS units, behavioral therapy, and other therapies we have discussed have shown good pain relief. Besides the few types of treatments we have talked about today, there are even more things patients can do, such as acupuncture, meditation, chiropractic care, and many others. With so many possible ways to get further relief, patients should explore the different therapies and find what works for them. Remember, these options are all part of a comprehensive management plan for your pain control. Talk with your doctor and your physical therapist about how to combine these treatments to get you the best relief and have the best daily life you can have.